Hi everybody. I wanted to take a quick moment to explain to you what is it that we do here in the office. Now if you've been a patient here for any length of time, I've probably given you a pop quiz and it goes like this. What is a subluxation? Now sometimes whenever I give that question, I get amazing answers. A lot of times I get a blank stare. So I wanted to make a short video explaining what a subluxation is, and the importance of defining this is because this, in essence, is what it is that I do as a chiropractor and what it is that we're trying to correct here in the office. Now, as everyone knows, as a chiropractor, my interest is in managing the health and the alignment of the spine and the pelvis. But in a sense, I'm doing that as a means to an end. That my goal or my interest isn't necessarily in the spine itself, rather it's in what the spine is protecting. Now your spine has a normal alignment. Your spine should be perfectly straight when you look at it from the front, and from the side, your spine should have these three curves. When your spine has the normal structure, normal alignment, it's going to serve its function very well. And your spine has three major functions or three major jobs. One is to simply hold you upright or to resist gravity. Two is to allow you to move, to twist, turn, and bend, which is why it's 24 different movable bones rather than just one long bone, sort of like your femur or your leg bone. But the most important job of your spine is for protection. And in particular, what your spine is protecting is your nervous system. So in a sense, your spine is a literal conduit or is a natural conduit. Now, what is a conduit? This pipe here on my wall is a conduit. Now, inside of a conduit, normally there are electrical wires, and the purpose of a conduit is to protect those wires so that the electricity can go from wherever it's being generated from, let's say the fuse box, through the walls, through this conduit up to wherever those wires are going. It's for the electricity to be able to run there unimpeded, unrestricted, protected. So in particular, these wires are going to the lights here in my office. Now, if you have normal function of this conduit, meaning if it's not damaged, then those electrical wires that are inside of this conduit are going to be able to send the electricity very well. However, if you were to damage this conduit here on the wall, and that damages the wires inside of the conduit, logically, wherever those wires are going, which would be my lights here in this room, those lights are not going to function correctly. Similarly, your spine is a literal conduit. Now, a subluxation is a misalignment of the spine, and that could mean many things. That could mean that you're getting curves in your spine that you should not have. That could mean that you are losing the curves in your spine that you should have. That could mean that you're simply rotating the vertebra outside of their normal position. Now, anytime you change the normal structure of the spine, you're going to affect its normal function. Structure dictates function. Abnormal structure, abnormal function. So if you misalign the spine, if you have a subluxation, you're going to change the normal weight bearing or the normal amount of pressure on the joints. That's going to cause your joints to wear down much more rapidly than they should, which we call arthritis. So if you have arthritis, chances are you have a subluxation. Now, it's also going to affect your normal range of motion. You're not going to be able to move properly because the joints are not aligned up properly. So you're going to lose the mobility in those joints. But the most important thing, the most significant thing that will happen if you have a subluxation is that you're going to affect your wires or your nervous system. Now, if you affect the nervous system, which is the master control system inside of your body, it's going to have repercussions. So your nervous system not only causes your muscles to move, your skeletal muscles, it's what feeds sensations up to your brain, such as pain or any sort of motion, vibratory, all of sensations that your brain can sense, so your body knows or your brain knows where your body is in space. But your nervous system or your brain sends signals down through your spinal cord, which is inside of the spine itself, out your nerves to every single cell, tissue, and organ inside of your body. So if you have a subluxation in the spine and that affects the spinal cord and or these nerve roots, that's going to affect everywhere that those nerves are communicating to. And that includes your skeletal muscles, but also out to all of these organs. Now, the most concerning aspect of a subluxation is that generally, especially when it comes to systemic function, meaning body-wide function, you don't feel pain. You don't feel pain. If you feel pain from a subluxation, likely what you have is something called a radiculopathy. And a radiculopathy is literal bone on nerve, or bones pinching, squeezing a nerve. Sciatica would be the most common radiculopathy that most people are aware of. So sciatica, by definition, means that you're compressing one of these nerves down in the low back. That nerve travels down into the buttocks and then down into the leg. So you get pain from the low back traveling down into the buttocks and down into the leg. Now, radiculopathies are in fact pretty rare. And by the time somebody has a radiculopathy, they've likely had a subluxation, or they've had a problem for a very long time, and it's just taken time for them to get that severe. But what happens every single time that you misalign the spine, whether you experience pain or not, is that it actually puts tension. Rather than compressing the nerve, it actually stretches the nerve, which elongates the nerve. Now, when that happens, pain is not going to be a consequence. However, what will happen is whenever you stretch a nerve, nerves in consistency are sort of like a piece of latex tube. Now, if I stretch this latex tube, the latex tube is getting thinner. Now, I want you to imagine that there's water flowing through this latex tube, and I stretch the latex tube. What's going to happen to the flow of water? It's going to be impeded. It's going to be slowed. So the water isn't going to go through this through this latex tube as quickly. Well, electricity functions similarly. That whenever you go from, if you know anything about electricity and wire conduction, that if you have a large gauge electrical wire, and large gauge means it's thicker, electricity will flow through that wire quickly. If you have a small gauge wire, electricity is going to flow through that gauge more slowly. Again, similarly with your nervous system, if your nervous system, the nerves and the spinal cord are nice and thick the way they're supposed to be, the electricity flowing from the brain through those nerves is going to go very quickly, which means that the brain is going to send signals down through the spinal cord and or out those nerves to everything in your body very quickly, very efficiently. However, if you have a subluxation and misalignment, and if that is stretching those neural elements, again, likely you're not going to have pain, but that is going to influence the speed or the conductivity of electricity going through the brain, through the nervous system, out to everything to the body. So it's very common when somebody has a subluxation that they may be or likely are experiencing symptoms unrelated to a musculoskeletal complaint, which is what most people come to see me as a chiropractor for. And by musculoskeletal, I mean neck pain or back pain or headaches or shoulder discomfort or hip pain. Those are very common consequences of subluxation, but those nerves also going out to the digestive system. So maybe some digestive irregularities. Those nerves are going out to your heart, they're going out to your lungs, they're going out to your reproductive system. So if you have a subluxation, our goal in the office is not to treat the symptoms that are a result of the subluxation. And I want to specify what that means. Again, most people come to see me because they're in pain. That's the most common reason people go to see a chiropractor. Now, my goal is not to treat the pain. And I know that sounds strange. What do you mean you're not going to treat my pain? Pain is a warning sign. It's let's say a check engine light. A check engine light coming on in your car, there's nothing wrong with that light or the check engine light. That's a sign to tell you there's a problem. Now, if you go to the engine, fix the problem, the check engine light goes away. Similarly, pain is a symptom, meaning it's a secondary condition with a primary cause. And if we can find and fix the primary cause or that subluxation, the symptoms, the body is able to heal better, and those symptoms hopefully will resolve themselves as a byproduct. Now, it's no more a miracle when low back pain or sciatica or headaches resolve themselves than it's a miracle if we restore better communication from the brain through the neural elements out to the rest of the body, that other areas within the body are able to heal themselves as well, or be able to function more effectively. And that's why we see so many children here in the office. This is why my own children have been adjusted since birth. It's not because they're in pain. And to be honest, it's not to prevent them from experiencing neck pain, back pain, or headaches into their future. Our goal is really to maintain the fullest communication, the fullest expression of life within their body so that they can be the best, healthiest them for the rest of their life. So if you have any questions on what a subluxation is, how it can impact your life, please ask me. If you know somebody who has never been evaluated for subluxation, they've never had a chiropractic evaluation or x-rays specifically taken to find out if there are any subluxations or misalignments of the spine that could be causing them health problems, then they can definitely come into the office to get evaluated either during a friends and family week. Generally during Friends and Family Week, we hold once a week, every single month here in the office for a donation. Anyone that you know, friend or family, can come in and get evaluated, and that donation will cover the cost of their exam and x-rays here in the office. But anytime a patient is referred in here to the office just to be evaluated to see if we can help them, that evaluation is discounted from our normal fees to 60% off of our normal fees here in the office. So if you want to learn more about that, please let us know, but more importantly, reach out to someone who you know and love and think that we may be able to help.